Governor, thanks for participating in this 6-month retrospective. Does it feel like 6 months to you, or does it feel like 20 years?
Yeah, it feels like 20 years. This 6 months has been the longest 6 months of my lifetime, but it's been rewarding in the sense of Arkansans pulling together, but it's not something that you anticipate as governor that you're ever going to have to govern during a time of a pandemic.
Exactly. When you get into public policy, nobody ever prepares you for a virus that can attack you through the air, and you find yourself at your age talking about things like droplets.
Yes, I've learned how to talk to epidemiologists, both to say the word and to talk to them. Yeah, it's a curve. I mean, I've dealt with national emergencies before, terrorism after 9/11 when I was at Homeland Security, but it's not the pandemic, the virus, that there's not an enemy that you go after because the virus is spread by innocent people, and that's what you've got to control somehow. So it was not something expected, but you deal with it, and that's a challenge in life. But the biggest thing is that it's just so long. That we're used to tornadoes that are here and gone. The damage is done, it's severe, or floods, but they all have an end point. And here, I know it's been especially frustrating for Arkansans because there's not a definitive time or even a definitive month that we can say this is going to end. Obviously, when we get a vaccine, it's going to end, but until then, we're all, figuring out how to live day by day, both in normal activities, but also being guarded and careful and trying to be a part of the team to make sure our case count does not go up.
And that brings me to today's announcement, the most recent development. The daily briefings are going to end and to be replaced by weekly or as needed. I noticed you emphasized that. Is it your fear that people will look at that and go, we're coasting now to a vaccine?
It's a concern that they would say, well, we're not going to take it as seriously, or we can let up in our guidelines and our discipline. And that's absolutely not the message. I tried to stress that the emergency continues, and the virus is still there, and that's going to continue until we have the vaccine. But the purpose of those daily briefings was to provide information. It was to educate. It was to share the struggles, ups and downs through this pandemic. And we have a good communication system now with our case report that's every day. We have the information that's out to the public in a variety of means. And then part of it was we were building our infrastructure, our testing capacity. We were worried about, are we going to have enough hospital space? Do we have enough ventilators? And we have our structure in place, the infrastructure that people have confidence in now. And so it was a good time to pull back on that, but the emergency does continue.
What, over the last 6 months, was the low point? The point where you said, oh my gosh, where are we in this? What was the low point?
Well, I would say every day that we had over 1,000 cases was the low point. And, it's in my world, it was a little bit ups and downs every day, depending upon, where are we on our cases? Are we making progress? Which we want to do. I mean, that's what I'm working hard to do, is to see that progress. And if you can't see that progress, or you have an uptick over 1,000 cases, that's a real downer for me. And, that's been a disappointment. I think, the other low point was whenever we hit a frustration point on testing and I couldn't get the right answers. And, it's one of those things that you can't control yourself. There's nothing I could have done at that point to say we're going to solve the problem of testing, because we were dependent upon our national commercial labs. And that was a very frustrating point for me.
Well, it's only fair that I ask you, what's been the most encouraging thing through this crisis. That continues. We're talking like it's over. 6 months is over, but it continues. But what has been the most encouraging part of this?
Without a doubt, it has been the dedication of our nurses and our doctors, our frontline healthcare workers that have had to deal with the COVID patients. That was their privilege to deal with the COVID patients, responsibility, but it was hard work for them. It continues to be hard work for them. And there was a point where all of our hospital space was tight, and that we didn't have enough staff in all of our hospitals. I mean, it was a strain on them. And then we were losing, some of our nurses to out-of-state recruiters, and so it put pressure on those that were right there. But that's an encouragement, is that the work that they've done and their dedication and the spirit of Arkansas whenever we support those in a lot of different ways.
It's been the strangest thing, Governor. I'm at the age, and so are you, where you have to be aware. And watching it closely, watching you, watching network news, watching what happened in New York City, there have been about 5 or 6 times during this rotten episode that I thought I was getting it. Have you had that happen to you?
Not really. I mean, early on there was, you have a little allergy, you didn't know enough facts as to everything, and so you say, wow, what's happening here? But that was short-lived, and I've only had one test when I went into the White House, but that's actually been a blessing for me, that for 6 months I thought for sure I would have to be quarantined, because I am around people, and if anyone turned up positive, then I expected to be quarantined. I'm surprised that I haven't had to be, and I give credit to my chief of staff and all the people around me that are trying to protect me and to keep their distance from me, and so I've been fortunate that I haven't. But it does make you think about it whenever I have grandkids, and my wife, same age as I am, and you want to hug the grandkids, and you do, but where have those grandkids been lately? and so yeah, those are natural concerns and wonderment as you go through this.
Yeah, before you hug a grandkid, you're going to have to go to them and go, I need references, please, and where you've been. It's obvious in listening to you that you're competitive. You want sports. You still want it. You play basketball still. How competitive are you, or have you been, with the other governors?
There's a natural competitive part of it in the sense of, how's our case count relate to other states? Or how are we doing economically? So you're always looking at the region, and that's why sometimes in my daily update I would go through the surrounding states and see how we rank. And part of it is you've got to put everything in perspective, and as we just concentrate on where we are, what's the perspective? What do these numbers mean, and how do they compare? And so, sure, you look at that, and you almost reach the conclusion after a time that this virus is going to ultimately impact everyone in close to the same way. Now, obviously, New York and California, the high-density areas, gets impacted much more harshly than a rural state. But beyond that, whether you sheltered in place or whether you kept open, the virus comes and goes, it seems, in an unpredictable way. I mean, California, nobody had a tighter economy or tighter controls in California, but they've had a resurgence. New Orleans, they had their first peak, and then they had their second peak, even after they clamped down. So it's just that, there's a certain amount you have to do, which I'm more convinced than ever is the individual discipline of wearing a mask and social distancing, protecting yourself and others. But beyond that, we can't shut down everything, because that causes incredible harm beyond simply the virus. So I think we've managed that well in terms of trying to control the availability of hospital space, spreading it out, flattening out that curve, and making sure that we can continue to move and live. And you're right, to even do sports and certainly school.
What's been tougher? People from your own party saying, I'm not going to wear a mask, by golly, we're going to have a Trump parade out on Lake Hamilton. Or the people on the other side who say, you haven't done enough. You haven't put enough rules in place to cut back on the cases. What's been the toughest?
Well, they've been equally tough and equally vociferous in their comments. If you want to lead and you want to worry about those things, you're in the wrong business. There's a lot of harsh comments on social media, but you just look beyond that. And those are, they're passionate, but I've got to make judgments based upon protecting lives and as well as making sure that we can live. And I've tried to strike that balance. I've tried to think through every decision and have it based upon data, but people will disagree regardless, and you make different judgments than other states and other times as well. So that's just part of it.
Has COVID-19 changed the way state governments relate to Washington, the relationship between the federal government and the state government? Has COVID-19 changed that?
It's emphasized the importance of the partnership and the role of the states without any question. And that's been an unexpected, interesting aspect of this, that the governors are probably closer than ever because of our regular communications and sharing information and ideas, best practices, but also our relationship, both Democrat and Republican governors working hand in hand with the White House and making our case to them and them listening to us. So it's really it's shown that our federalism system of government, the partnership between the federal government and the states, actually works pretty well. Some people say, well, that you should have had tougher national guidelines versus state guidelines, and I don't think any governor agrees with that. The governors believe that their state is unique. They can make good decisions based upon information in their individual states, and we've by and large done that with federal support. So I like the way that dialogue has been and how it continues.
It's got to frustrate you looking at Congress where the battle lines remain drawn to the point where nobody does anything because things are so concrete.
It does. I mean, Congress should reach a compromise very quickly and make a decision on the next round of relief. There's a few things that are important to Arkansas that needs to be included in that should be readily agreed upon. But they have the partisan differences and they're locked in, and I don't expect that to change until after the election. And Craig, the only thing worse than a pandemic is a pandemic during an election year. And that regretfully has put greater divide that ordinarily would not be there. When we started out in March, I mean, it was national unity in terms of how we address this and listening and how we're really together in our approach. And, as time has marched on, I think because of some of the partisan divide, the elections, that has become more divided, and that's very, very regretful about this.
Your biggest lesson over the last 6 months, what have you learned about you, first of all?
Well, I've learned to shift gears to, I got elected governor to be a job creator, and it really goes against my grain as a Republican conservative governor to put restrictions on business. And but I also learned you have to make those decisions during a time of emergency and really a calamity, and I was able to do that. So it's really not about, I felt like I've been in emergency circumstances before that I've had to leave. This is different, but you apply the same principles. But in terms of what I've learned is really the resilience of Americans and Arkansans. Whenever you look at how they understand a neighbor might be quarantined, or they might be afraid to go out because they're elderly, and they'll take food to them, or they will make sure they're taken care of, to see the responders and the healthcare and our hospital system that has worked together even though they're competitive. These are really good things that I've learned and observed, and and we're not through it, so there'll be time to reflect back, but those are things that really stick out to me.
Without mentioning names, do you have an incident where you have encountered a family that lost someone to COVID-19 that in a lot of ways inspired you to move on, to go on, to persevere? Have you had that happen in the last 6 months?
Yes, I've lost a number of people, a couple of people that I knew, was somewhat close to. There was one family physician that got COVID and fought very, very hard for a long period of time and died. And that was a personal loss, but it was a loss to the entire community because they were a dedicated physician. And that hits you hard because it becomes very personal, that you see their fight for life, and they're not a statistic. And that can be, one of the early ones that we lost was a veteran and a former Razorback football player we lost. And these are surprises to us all, but early on, we mentioned some of their names when we had permission, because that's important for people to understand the human side of this. It's not just a statistic, and people think I just read the numbers and somehow it doesn't touch me, but it does.
Well, we're moving on. This is a 6-month retrospective. Looking forward, what do we do?
Well, we stick with it. We plow through this, and that's the best description I can give, is we plow through this. And we do it by consistency in our self-discipline, in protecting ourselves and others, social distancing, and wearing a mask, which nobody likes, but we have to stick with that and we have to plow through it. And the reason is, and we ought to be motivated, because that allows us to have school, to have sports to watch, to go to our grocery store, and to be able to go to our job because they're not shut down. And if we ever give up on those self-discipline aspects of it, then we lose on the normal life part of it. That is what we've got to do, and to plow through it, because until we get that vaccine and until it is broadly distributed, then we're in the same boat. And whenever you look at right now our cases are going down, but I don't know that anybody would be surprised if in 2 months they go up. And we've seen that because viruses act that way sometimes in the winter month. I think our coronavirus task force has cautioned us about this, and so we have to be realistic that this is not going to go away until we get that vaccine, and until then, plow through it. And no one is more courageous and resilient than Americans when it comes to those kind of challenges.
When you go to a high school football game, I got to know, do you look at the scoreboard first, or do you look at the crowd first to make sure they're socially distant?
Let me tell you, I look at the crowd, and I wouldn't hesitate to grab a microphone and say we need to do better. Or I would probably say I want to applaud everyone here that is doing the right thing, and just be an example to everyone else. But that's what's inspiring to me. These kids are so committed to being able to finish the school year, or committed to being able to have a chance to play football this year. And that's what one athlete made the case to me. I know you can't guarantee that we'll be able to finish, but give us a chance to start. And then, as they're an example to others in their community, because they want to be able to finish, so they put up their helmet, they grab a mask, they go to school. And I see that desire and commitment on their part. It's what an incredible part of growing up and learning responsibility in a different way that no one expected.
Thank you, Governor, and thank you for taking time to look back and to look ahead. And we'll look for you once a week, unless there's something else, and we hope there isn't anything else. Thank you.
Absolutely. Thank you. Great to be with you.